Welcome to this webinar. So today we are going to talk about the CalproSmart DeepLink application. I'm going through the technical information first of all, and then I'll show you the demo of this application. So before I start doing that, so today's agenda is, give me a second. So the agenda is, first of all, as you see, introduction is Ingrid doing, then second, Weissman. So the Neve are going to talk about their application and show us in the demo. After that, I'm going to show you the DeepLink application and the demo. And the last one will be the questions and answers. So Neve, if you can just start, it will be great.
Yes, thank you, Baha, and good morning and hello to everyone. It's a real honor to see you here, all the familiar and non-familiar faces. I'll start by introducing myself. My name is Niv Zmora. I'm a scientist and a physician from the Weizmann Institute of Science in Israel. And I would like to thank Calpro for this very fruitful and wonderful collaboration that we started a while ago. It's going on very well, and I would like to tell you a little bit about it this morning. But first, I'll introduce my study. So this is a multi-center study that encompasses 8 countries around Europe and in Israel. It's a study about pediatric Crohn's disease, where we collect longitudinally data on children with Crohn's disease from the onset of the disease, and we are tracking them in terms of their daily activities, and then we want to link their daily activities and most particularly the food that they eat to their disease, which means the disease flare-ups or their remission or relapses of disease. And after we've acquired this big amount of data, we would like to actually implement bioinformatic algorithms in order to understand what, in terms of food or other daily activities, can affect the disease. And we would like to do it on a personal basis. And our purpose is to actually create individualized recommendations for children and tailor their diet and daily activities. So for that to happen, we had to design our ad hoc smartphone application. This is our main logger. And through that application, we're logging the children's daily activities on the one hand, and on the other hand, we would like to log their disease manifestations. And then we would like to actually link those activities with the symptoms of the disease. So this is where Calpro comes into play. Calpro is actually one of our ways to record a very reliable and a quantitative measure of their disease activity. So I'd like to share my screen with you and show you how the application looks like. Let's see if I can make it. Okay. So okay, so I hope you can see my screen, right? Great, I can see you nodding. So this is the main screen. It is designed in a very user-friendly ways for children and their parents. I'll explain just bits about the app because it's not the main topic of our conversation. So you can see here that we have multiple languages that we can choose from because this is a multi-center trial. And we have this clock icon on top, which is the history, like the history that whatever actions that the children and their parents logged, and we will get back to it later. And then we have the main activities to be logged. So you can see that the child can log their symptoms, and here you can see an example of the symptom screen where you have the headline, then you have the date and time that the default is right now, because usually people log their current activities, but it can be changed. And then you can see the main screen itself. So in the symptom screen, the child can actually, there is a visual analog score of their feeling today, and then whether they experienced symptoms that are related to Crohn's disease. And then you click on the check button, and this is how the child logs their symptoms. And very similarly, you have here the school icon that can show you whether they missed school as a measure of how severe their disease is, because we believe that a child that missed school is experiencing a more severe disease. Then we have the stool icon, that this is where the child can log their bowel movement, and you can see Bristol score here represented by those little pictures, their stool volume and the associated symptoms. And at the bottom of the screen, we have the measure calprotectin button, and this is where we linked to the Calpro app, and I'm gonna go back to it very, very soon. And in the end, we have the food icon, and this is a very complex screen where the children can actually add ingredients of meals. For example, they can look for, let's say, pizza, and they get all sorts of pizza that they can pick. They can add the units, whether it's grams, a large portion, small portion, and this is, of course, this uses a food database for every country and their local food, and this is how we actually can trace the link between the food that the child consumes and their disease activity. And of course, we know the database contains all the nutrients and all the micro and macro nutrients of that particular food item. So additionally, there are other options that the children can log, whether it's sport activities, medications, stress levels, and so on. But we're gonna focus more on the stool right now. So if we wanna go to, if we wanna report a bowel movement, we can pick, of course, the subjective measures that are the appearance, the volume, and the symptoms. But we can also log the calprotectin level using this button at the bottom of the screen. We press it, and then we're transferred to the CalproSmart app. We start the process, just the standard process, like any other user of the app does, and then we go through the entire process. You know, this takes time, so I'm not going to show you all of it. I can just show you the end point, that is when you get the result, it looks something like this. We see the result, and it's transferred back seamlessly to our app, and it is recorded in the history. As you can see here, calprotectin level 96. So for us, it's a very transparent process where the child can just click the button and then is transferred back when the process is over. And we have a calprotectin level that we can follow up in real time. So this was a short demo. I'm just going to talk a little bit about this, deep linking. Okay. So, when we first wanted to check home calprotectin kits, we did a very large survey of companies, and we decided we're gonna stick and go with the Calpro, and we're very, very happy with our decision. And the rationale for choosing Calpro is manifold. First of all, we have the on-the-spot test. It can be performed remotely at home. And this is a great advantage both for the users, the children and their parents, and also for the physicians that follow up the study, and also for us as researchers. We basically, we can see in real time the trends in calprotectin levels, and this is very valuable for us, and also for the users who can really trace the progression or the regression of their disease. Another important thing is, like, as I mentioned before, this is a quantitative measure, and of course we rely on reported symptoms, but having this number, this objective measure of disease activity for us is very important, and of course a validated and a reliable way to assess the severity of Crohn's disease. And lastly, we know that at this time of a global pandemic, children and parents are sometimes reluctant to go to the clinic. So having this opportunity to perform a test at home is very, very valuable for us. And it really does not impede the course of the study, and it really helps us. So we're very happy with this collaboration. And I don't know a lot about the technical implementation behind it, but it's working smoothly and seamlessly. And for us, it's very, very helpful. So that's the end of my demonstration.
Thank you so much, Liv. It's really interesting to see this. We are so happy that this came along and you could actually demonstrate this for us. It makes it definitely easier for you to collect data, right, in your clinical trial. Very exciting to see. Thank you.
Thank you.
So now Baha will also have a session.
Yes, give me a second. I hope you see my screen now. Yes. So before we start showing the demo, I want to give you a short introduction on what the deep linking is. So first of all, the CalproSmart DeepLink is a home testing app to support management of chronic IBD that enables integration with third-party applications, providing information to IBD patients. And CalproSmart is a system to monitor the effect of medical treatment in patients with inflammatory bowel disease. So the app is a part of Rapid Home-based test system that, by calculation of the concentration of the calprotectin protein in an extract of feces. Both enables identification of possible non-responders and patients who are in early phase of relapse. The app gives you detailed step-by-step instructions on how to perform the test, as Neil showed you. And the concentration of calprotectin is determined by color intensity of 2 lines on the test, which is based on antibody-antigen reaction. Using a smartphone, the patient captures an image of the test, which is used by the system to calculate the concentration of calprotectin. And the level is shown as traffic lights in the display and concentration given in mgn. So if we move on to the next one. So here's the technical information on how to integrate your app with CalproSmart DeepLink. So first of all, you see you are the actor. You have your application, let's say Neve's application at the moment. So then there you have a button that links to the CalproSmart DeepLink. So when you press that button, you'll be moved over to second step 2, where you use your username and password that is registered in Calpro portal. So the only thing you do in the portal is to register your account, that is a staff user or integration user. Integration user means that the one user that wants to link the app with our. Then from our portal, the token object will be given to your application. So, and after that, the fallback URL data token will be moved over to CalproSmart DeepLink. So when you finish the test and take the picture, then the token will be moved over to Calpro portal. And from here on, Calpro portal gives you a list of batches, of valid batches, and then you have the information that goes back to your application. That is data, classification, date and time, and text. So this is the objects that you are getting back to your application when a test is finished. So the 5 big steps in the application is that, first of all, you open your app and that links to CalproSmart DeepLink. Step 2 would be that you start the test. As Niv showed you, you swipe and move on to the first timer, that is 3 minutes. So there you have to shake the sample for 3 minutes. And step 4 will be the second timer, where you incubate for 15 minutes, and then you get the result and data transferred to your application. So this is the 5 big steps. So next will be demo. So right now I'm going to show you the demo. I have to move over to my phone. Just give me 1 second. So can you guys still hear me? Yes, super. So I guess you are seeing my screen now. So when we start from the stretch, so this application will be your application that have a button where you link with DeepLink. So from your application, you press the button Open Calpro Lite, and that means CalproSmart DeepLink. Then you get the token and move over to the CalproSmart DeepLink application, where you have a button that says Start Test. When you press the Start Test button, you will be given the information in your language, and the whole process takes about 20 minutes from the app itself. So this is the test app only. So I'm going to show you the whole process. So you swipe and you will be given information on each window. You move forward, reading information on how to perform the test. And you see the first timer here. And then you have to shake the cube in 3 minutes, and in this test application, it will be only 4 seconds. So it will be pretty fast. So the first timer is finished. You press the finish button. I have it in Norwegian language, so it will be translated to many languages. We have about 19 languages that is translated. So you move forward, swipe, and then you get to the 15 minutes timer. So then you start the timer. It will be 15 minutes here, but this time it will be only 4 seconds. And then the camera opens automatically with a flashlight back. And you have the yellow frame, the timer down here. So you will have the 2 minutes after the camera opens. So you have the 2 minutes to read the cassette. So now I have the cassette here. As you can see, frames are the same, so you will have to place it correctly. And then you will also get the scanning tips. It says and how you should move your phone. It says you have to tilt forward and backward and side to side if you don't get to read the cassette. So we'll first of all read the barcode. It says searching for barcode. Now the barcode is scanned and it looks for the test line. Then we will slowly hold a camera over the test and then it gives us the results. As I described earlier in the presentation, you will be colored, you will get the result in traffic lights, as you can see. So this result is 807 mg, and it gives you the time, result, and information. And as you can see in the red color, it says that the test shows high inflammation. Contact your doctor. So you have the result now, and you want to move it back to your application. So you just press the finish button, and there, as you can see, overall result is severe, status code 200. That means that it's okay, and final consideration given. So this is, as I mentioned, the test application. It will be looked much different on your apps. So at this time, just so you can see, we have the result here, and you can also move back to your to CalproSmart and take the new test if you want. So that was it. I'm moving back to you guys.
Thank you so much, Baha. Very interesting. Now we can open up for questions if there are any questions.
I would just like to add something that I forgot to say. It's very important in terms of our trial and research, and this is the keeping the data anonymous. One of the reasons why we actually implemented the DeepLink is the fact that the standard procedure of the Calpro app is to identify the user by the email or some identifying data, and we wanted to bypass this. We wanted to have a link without identifying the participant. This is very important for the sake of the anonymity of the trial and confidentiality of the results. And by implementing this deep link, we could totally bypass this identification step, and so just only the results are transferred back to the app, and we don't need any identification. And for us, this is extremely important, and this is something that is mandatory in the study. So thank you.
Thank you. Just to add something, I would also say that DeepLink does not store any information from any patients or any users. So it is completely the simple app that gives you only the result that you want, the data you want, and nothing else will be saved in any platforms or in the back end or in the front end. So you have the basic app that you want where you take the test, and the test is moved back to your application. So simple as that. I can see that Brian have the question.
Yeah, good morning. What's the process of linking your app to CalproSmart? Who do we contact?
Did you mean what is the process that if you can repeat?
If a user had an app and they wanted to link it to CalproSmart, how would they go about that? Who do they contact? What do we do?
So basically we have the documentation that everyone needs, first of all, to implement this. And there we have all the technical details for both platforms, Android and iOS. It will be what I can say, it will be much easier to understand it from the documentation. So I can also send the documentations to you guys, to everyone that needs it. So there's all technical information. So the first thing you also need is the token and the fallback URL. This is the two most important things where you connect the app. I don't know if it was the answer to your question, Brian, but
yeah, more or less. If we contact you, you can send us the information, and then their IT people can do the link. Yeah.
Of course, yes.
I'm not so good with the IT, so I keep well away. So.
But Brian, I'll just add a small comment that very often, if you have a third-party supplier of an app, we very often go to them in a meeting together with you to explain the solution and so on. So that will be to get us in contact with the IT developer, and then we exchange all the technical information.
That's great. Yeah, fairly straightforward. Yeah.
Yeah.
And does the parent of the child have the app rather than the child when they're doing the test? Just
So our study encompasses children from the age of 6 to 18.
Right.
So it really depends on the age. So it's either the guardian's responsibility or the child.
Okay, that's fine. Yeah.
We have another question coming in here from, I don't know if I pronounce your name right, Avais Akhtar. The question is, to get the token, user has to provide username, password every time, ? Or it's just one time?
Otherwise, I can answer on that question. So the token will be on a one time, and it will be more or less saved, as you can see in other words. So this time, so you only have the token for one time, and all other times you just move over to application. So you don't need to write the username and password every time that you use that.
Baha, you should also perhaps explain who usually registers for the token. This is typically an IT guy at the third-party company, I think. It's not the patient, it's a technician.
Yeah, it's technician that gives it's a technician that gives you the token.
Yeah.
Yeah. Any other questions?
You have one hand is right, BP.
Nope. Sorry about that.
No other questions or comments to Niv, perhaps, or to Baha? No. Well, I'm very, very excited about this. We have seen now that DeepLink is a really nice add-on to CalproSmart. It gives research teams and doctors and every healthcare institution the possibility to link up, patient-reported outcomes like PRO apps together with the Calpro results, and then the doctors could have the whole picture. How the patient is really feeling, or yeah. So I think this is really, really a nice feature. And thank you, Niv, for explaining your research, how you have actually taken this DeepLink into your own patient report app. So really excited to know about that. And thank you, Baha, for explaining the technical side. So if you have any questions, please, you can contact us, of course. You can contact me. I have here, you can write down my email. Any questions related to CalproSmart, please contact. And we will set up a session with you and explain how this works if you have projects or whatever. So please contact us if any questions. Thank you, and I will just now finish up here, close the record, and you are free to go if you don't have any other questions.